It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, IU Health is seeking approval from the city of Carmel to build a new cancer center. Barbara Lewis has more in the Business of Health. Barb?
Well, Gary, thank you very much. The $55 million cancer facility would be built on property that is already part of IU Health North. So joining me to talk about the details is the Executive Director of Cancer Services at IU Health, Katie McGill, and oncologist, Dr. Sarah Jo Grethlein. It's good to have you both here.
Thanks for having us.
So let's start with you in terms of why this is needed. We're familiar with the Simon Cancer Center downtown and some of the satellite facilities on the north side. Why a comprehensive cancer center?
So we're very excited to bring together all of the cancer services in one location for our patients. Right now we've got a great palette of services that we make available, but it's not as pulled together as we'd like it to be. We can offer chemotherapy, radiation therapy, surgical oncologists, and support for the patient and family all in one location, as well as access to clinical trials and the current research. It's a real win for us.
Yeah. And Katie, let's talk a little bit about the approval that's needed from the city of Carmel, and then also kind of the timeline for this project. What's the next step?
So we want to be respectful of the design considerations for the city of Carmel. So that's the initial part of the process, is the appreciation for the aesthetics of the outside of the building. So we anticipate having those appropriate approvals by the end of May of this year.
Okay, and then once you get the approvals, then when's construction and when would the facility open?
Yeah, so we anticipate a fall or September groundbreaking on the cancer center, and then we would see our first patient in about 2 years.
Okay. And then, so in terms of services, you've touched on some of the different services, and they would be just, would it be more that they would be concentrated there, or this would be really new for the north side?
So there's going to be new emphasis on the academic interest that we can bring forward, and that also translates to new services for patients. Our precision genomics program, for example, will be a strong presence at IU North. Pediatric oncology will be present at IU North. So even though we have many of those pieces, bringing them all together is part of what's different, as well as things like art therapy and music therapy and supporting the whole family.
Okay, when we looked at the renderings, we noticed that the cancer center will take over a parking lot, a pretty substantial parking lot, and parking is always something important to patients and their families. So what will happen then? Are you expanding the parking there as well?
Yes, so that will come first, so we don't disrupt the inner workings of parking and the flow of the hospital campus. So the groundbreaking for the new parking lot is in July, and we intend to replace the spots that we're taking and then some.
Okay, and then the services that were offered, the infusion center at 103rd and Springville, for example, will those continue to operate, or we see some shifting and closing?
Up until we open, they will continue to operate, but then our IU Health services that are at Spring Mill or currently at IU North will move into the new cancer center, as well as some expansion.
Okay. All right. Well, thank you both for being here. Appreciate your time, and we look forward to the new center opening and the approval process going smoothly.
Thanks so much.
All right, thank you. Gary, back to you.